Hello and welcome. My name is Tracy. I'm the Director of Marketing at Mind Plus Neurology, and our focus today for our wellness workshop is Strive for Five. Aaron Hart, our co-founder and CEO of Mind Plus, is going to give us an overview, what it means when we say Strive for Five. All right, you got it.
Okay, thanks, Tracy.
Yeah.
So strive for five. So the really what this is about is we're putting together a framework to follow for a few different reasons, and we'll get into that, and then what it means, and we're going to share kind of what we're doing about it to try to help patients get there. But at the end of the day, it's about really setting a goal for achieving less than 5 headache days per month, which is really the big thing that we want to help our patients and help other patients from other practices, seeing other providers understand that's really an appropriate goal to try to set for yourself and for the practice that's working with you, and then achieve a pain level that's appropriate, and other objectives and targets that you want to set for your treatment plan for how you're doing with your head pain, your headaches, your migraines. So I talk about this a lot, and we meet patients every day that this really applies to, which is what we're trying to really get people to understand is that, and what we don't want patients to do is settle. So it happens very frequently. It can be very labor intensive to try to get better, to try to find a doctor and a care team that can really help you and actually make a big difference where the effort that you put in to your treatment plan, you get commensurate value out from that. And when that doesn't happen, it can be very difficult to continue trying to get better. And a lot of times, folks settle for how their condition is and how it's being cared for. But the reality is, we all have one life to live, and we want to help patients really live that life to their fullest, and in the least amount of pain possible, and ultimately do all the things that you want to do. And so, achieving pain freedom, the freedom to live your life in as little pain as possible, is not a lofty goal, which is, my quote. But that's what I say, and that's really how everybody feels, here at Mind Plus for sure. So strive for five fundamentally talked about it being a framework. So in headache medicine, we measure how well your condition is controlled by the frequency and then the severity of your head pain. How many times are you getting a headache, which we'll measure on a monthly basis? So how many headaches do you get per month? And then when you get them on average, how bad in pain are you? How debilitating are they? And we rate that on a scale of 1 through 10. And so striving for five is really about how do we get it to less than 5 days per month and more than a 50% reduction in your pain, ideally getting you to a score of less than 5 out of 10 when you do have an attack. And that when you do have something, you have the tools to kind of help you break that down to a level where you can still kind of go about your day and do the things that you want to do. Everybody who has migraines and has had them forever typically understands. But some folks who are early on in their care journey, the reality is there's typically no cure for headaches. And so it really comes down to how well we can really treat the systems, do that with the least amount of symptoms possible, and do that not only with medication, but also with other natural therapies, which we provide here as well. And that all of these things are a key component. And where your treatment is going to be the best is when all of this really sings together, providing you with the best outcomes. And so here it is. So strive for five. Why? Why strive for five? Well, one, it's catchy. It rhymes. So that's great. It rolls off the tongue. And that's the idea. It's very simple. Make it demystifying all of this to help, number one, patients understand when should they seek care. And so if you're having 5 or more headaches per month, that's a problem. Absolutely, you should be seeing a specialist for. Keyword on specialist. And that's the thing. Typically, it's been hard to see a specialist, but that is the fastest, clearest way that you're going to be able to get on a treatment plan that's going to most effectively get your headaches under control is going right to the specialist. This is where places like us come into play and can provide that level of care and expertise for the condition. But if you're having 5 or more headaches per month, this is when you should be seeking care. Um, it's about setting expectations, expectations for you as a potential patient. So setting what those goals are and achieving them. So 5 is kind of the simplest way to put it. 5 may not be everyone's goal. Everyone has a very different condition. Your goal may be less. Like, no, I want to get down to 1 or 2. And that can be possible. And we do that with patients all the time. Others with more complex and severe conditions may set a higher threshold. That's okay too. But from our standpoint is we want to make clear for patients everywhere, not just Mind Plus patients, but anybody, it is okay to set that goal and have that expectation of yourself to get to that level. Um, and then third is setting expectations for your care team. So, feeling comfortable, like what should you expect from your headache doctor, and the people that are taking care of you and trying to get you better? This is what you should expect. There's no reason you should not expect this. And people should feel comfortable with that. And so in the end, it's about, for us, how can we help set a new standard for headache medicine everywhere, and not just here, where we are today in Wisconsin, but how can we help set that everywhere else around the world? And so you'll find, especially in headache, because it typically is a more complex condition for doctors to treat. Um, a lot of them are not comfortable really promising or setting these kinds of expectations. We think those expectations should be set, and it should be not only the patient's goal, but the practice's goal to help you get there as close as possible and get you as well as possible. Again, so you're being able to get back to your life and do the things that you want to do. And so we try to distill this down just super simply into strive for 5. That's what you should be doing. And if you're not seeing anybody today and you're having more than 5, like come see someone or come see us. Um, so there's a few different components when we talk about this. So I've already mentioned this, right? Fewer than 5 headache days per month. So less than how often you're actually having a headache. So frequency is very important. Also, strive for 5 or less out of 10 in pain when you do have a headache. Um, and if it exceeds that level, that you have the tools necessary, more often than not in a medication. And it may be a combination of a medication with some non-medication relaxation practices, cold compresses. A lot of patients love ice hats, all kinds of things. We want to make sure you have the tools that you need to be able to achieve that. Because if you're having 5 or more out of 10 in pain, there's really not much you're going to be able to do and function with. And again, go and enjoy your life. Um, and then these last two things are important as well. So, um, what should patients be expecting from starting a treatment plan? What should you want from your treatment plan? And without a doubt, at minimum, a 50% improvement overall in your condition. Um, so of course, there's the frequency and the severity as being those two key measures. But wherever you are on your spectrum, like you should expect that. And in addition, it shouldn't take 2 years to get there. From what we do here at Mind Plus, 9 out of 10 patients will see a 50% improvement here following our treatment plans in less than 5 months. And you should expect and demand that from, wherever you're getting care today. And this can be done with a lot of different ways. So one is just, the right diagnosis, the right treatment plan, and all of that. But very much a lot of headache medicine is there's many tools in the tool chest that can really help patients achieve this goal. And so, but you have to learn really quickly what works and what doesn't. And the key thing is you need to really aggressively pursue what is and what does work. And when something doesn't, very quickly pivot off of it. Oftentimes, what happens at a lot of practices, patients will be put on a medication, and you will not see that physician again for at least 3 months, sometimes as many as 6 months. And so, in that time, you may have learned in 6 weeks, which typically is when you'll actually be at a therapeutic level, as long as your care team is dosing that medication correctly. In 6 weeks, you're going to find out whether that's really working or not and what it's doing for you. So here at Mind Plus, whenever a patient starts a new medication, a 6 week follow up is standard, because we don't want you on that medication longer than you need to be. We want to get you better as fast as possible. Like that is the end all be all of everything that we're doing here. And I think it's hard for a lot of patients to understand, well, I've been working at this for a year with my doctor. I haven't gotten to where I want. Well, that is a problem, and you should do something about it. And this is what that's trying to say. So strive for five. So strive for less than 5 months. You're seeing the improvement you want to see, which should be at least 50% improvement from where you were. Um, so that's the framework. And then I wanted to share a bit in terms of, well, what's our approach to this, our strive for five approach. And so really kind of two areas is where we, invest a lot, and feel it's really important to invest in our patients. And first and foremost, it's the team. So what's unique about us is the care team truly is comprehensive. So a lot of times you'll just have your one provider that you work with. It may be a neurologist, maybe a nurse practitioner. It may be someone who knows headache a little bit, maybe somebody who doesn't know headache at all. And so here at Mind Plus, our patients all have multiple care team members that are really helping them along this journey to as help them get better and as fast as possible. So first and foremost, headache neurologist. So absolutely, without a doubt, headache medicine is very tough. It's a very tough field. Not a lot of doctors specialize in it. It's less than, this year's fellowship program of doctors that come out with their subspecialty in headache. It's like less than 40 across the entire country. And you have more than that retiring out from the field every year. So there's fewer and fewer providers out there that really, really know the field and know the medicine, and it can be very complicated, which is one of the reasons why a lot of docs don't go into it because it's inherently difficult. Um, and so it starts with having a double boarded headache neurologist. Super important. They're kind of the cornerstone of a true headache program that's very serious about getting their patients better. And not only do they act as a great resource and a first step for our patients, but they're always there to lend support for the entire care team and patients when and if they're needed, to be able to provide that while they're still working with new patients that are coming in and really kind of just dissecting the code and putting together a really good treatment plan that's going to get them as well and as fast as possible. Um, we also have your headache specialists. So these are also providers, doctors, nurse practitioners. There you see Gable, she's our nurse practitioner. So there, it's important to have somebody who's still super deeply specialized in headache, um, but it's highly accessible. It can be there for 80% of the needs, that our patients have. So you're not waiting on when, say, the headache neurologist may be available, but they provide another perspective, another point of view for you, which is also very important in headache care. You want multiple points of view and multiple people kind of looking at your case, reviewing your chart, understanding your situation, and then providing you with guidance and options. Um, that is the absolute best way to keep iterating and get you on the best possible treatment plan. Um, and then, of course, that accessibility is super important as well. And then the third in this provider category is our neurointegrative therapists. Um, so we just started talking a lot about this, this year in 2024. But there's we talk about getting to where you want to be in your headache journey, and getting to as few days as possible with the least amount of impact on your life as possible. Uh, the treatment to get there is like a cake, a lot of layers. Should always be thinking about your treatment like that. There's not just one silver bullet that's going to cure cure you, make everything better. Just one pill that you take each day and with no symptoms and everything's wonderful and great. Um, there's layers that you want to keep applying. And this is a very important one, the neurointegrative therapy, and something that only we do here and no other practices do. So we have a team of occupational and physical therapists. So these are true healthcare professionals that can help with not only treatments, natural treatments for acute pain, but also for preventative. And a lot of times, your pain, may be coming from a lot of different areas in your body. One of the most common is the neck. And so neck pain and treating that and positioning patients to be successful in order to manage their neck pain can go an immense long distance in really helping patients get better, and achieve the goals that they want to get to. Because many times in migraine, it can be about treating the triggers, the things that are really driving then the head pain, which is then caused. And those triggers can be very much related to other aspects of your body, which our neurointegrative therapists can help you out with. They also help with balance, vertigo, dizziness, or vestibular system issues, we call them. And then also from a consultation standpoint, just helping manage daily living, and helping manage with the pain when it does happen and how you can still do the things that you want to do and still function. Many patients, that are struggling with, say, balance and dizziness issues, they can't drive and they want to be able to drive again. And they're going to help you do that. They're going to help you both manage the condition, but also position you up so that you can do that activity that you ultimately want to do. And then that's what success looks like. And then definitely another huge important part of the care team is you have your clinical care staff. And so, these are heavily experienced, registered nurses typically, which are obviously going to be there with you when you're here for your visit, your new patient appointment, your follow-up visit. But they really not only are driving that connection with you to understand as well another perspective of what's going on with your condition, but they're going to help you with the ongoing management of your treatment. They're there to support you with any kind of medication questions and other things, which they have experience in dealing with. But then they're also going to be here for you when you need intensive, very serious therapy to be delivered to break a migraine that you may have going on in our headache urgent care. And so they're definitely a big core aspect to the team, um, and big partners in the care of helping our patients get better. And then lastly, our patient success team with our patient success specialists. So, um, there's finding the treatment clinically that really works for you. But then you also need to get it. And sometimes there's a lot of navigation that needs to happen in healthcare. Unfortunately, that's our reality here. But there's a lot of navigation in healthcare, and especially with insurance companies and state and national government plans like Medicaid and Medicare to actually help you get in an affordable way access to the treatment that you need and that and what works. Sometimes it's very easy. Sometimes it's incredibly difficult. And we're always about doing everything that we can, especially when we find a treatment that works, is really making sure that our patients have access to that on an ongoing basis. uh, you know, you may have yourself or know people who have dealt with issues before where they have found something that works, but then ultimately they can't go on it because insurance didn't authorize it. Insurance doesn't want to pay for it. We help patients all the time get access to some of the most advanced medications out there, which can be, $1,000, $1,200 a month, which is, crazy. You don't want to be spending that per month. You can't. I mean, who can afford to truly do that? Um, we help in situations like that all the time, getting patients those same medications for usually next to nothing, sometimes completely free. Um, but it's work, and you have to be willing to go through that work and go through that effort to help patients get there, and that's what this team does. And not only that, but beyond that, right? It's getting you scheduled and working you into the schedule when you need to be seen. You're never going to call here at Mind Plus and be told, yeah, we can't see you for 4 months. Sorry, can't work you in. That's never going to happen. It's never the case. And the reality is that's all time that you're losing when you could be making a change to your treatment plan, finding something that works better, and getting better. And all of these things, and everybody on this team needs to work together with the patient to truly get better faster and get to your goal, which should be less than 5 headaches a month. And then really the last thing I wanted to go over is, talked about the team. This is our approach and what this team helps patients through. And all of this ultimately culminates in every single one of these pieces is so super important to really help patients achieve, striving for 5, getting to that goal, less than 5 a month, less than 5 out of 10 when you actually have one, improving, at least getting 50% better, cutting your pain in half and how many headaches you get in half in less than 5 months. This is the formula. This is what we know works with that team that I just walked you through that's going to help you get there. And so it starts on the left, the right diagnosis. This is when your double board certified headache neurologist is really going to ensure you have the right diagnosis and you start off with the right treatment plan and framework in place. And then from there, any good headache treatment plan should have two components: preventative and acute. So you should have something on board prevention wise. What that is going to do is proactively, it's going to reduce how many headaches you have and how bad they are when you have them. And then when you do have one, if you have the right acute or rescue therapy, as we call it here as well, then when you do have it, you can take that and it will break it. And then you can keep doing the things that you want to be able to do. But those two components are really important. Prevention can be anything from medications to their various treatments and procedures that we perform in office here. Botox is a well, maybe one of the most well-known preventative therapies. It certainly has been around a significant period of time and is clinically proven to help prevent migraines. But there's a lot of other things such as nerve blocks or different infusion therapies that can be done, especially in advanced cases. And then you have neurointegrative therapy, which is really helping you beyond medications. What can you be doing physically different? How can we be helping your body and give therapy directly to your body that's going to help with your triggers, reduce in the end how much pain you're actually experiencing? And then when you do have a debilitating migraine and your medication isn't working, instead of having to sit at home for 4 days in pain, not able to do anything, in the dark, in bed, and just not present in life at all, you can walk in to a Mind Plus facility and you will get treatment for it. And the what we've done since we've opened is the patients that do walk in, we're so efficient and effective here now and really have figured this out for folks that within 60 minutes of when you walk in the door, your pain will be cut in at least half. That's 9 out of 10 visits that occur. That's how effective it is. And so you're here for 60, 90 minutes in total, and you're ready to get back to life that day, or could carry on with your weekend plans, whatever they are. But that's a huge component because when you have migraines that are out of control, it can throw everything else out of whack, not just in your life, but it can affect your overall treatment plan as well. And so, this is a great resource that our patients have access to. And ultimately, it's all about getting to what we call sustained control. Um, you're in a really good spot. You're only having a few headaches a month, maybe even zero, depending on whatever your scenario is and what your goals are. But all of these things coming together culminates into really having control and getting back control of your life and being able to do the things that you want to do. And so when we talk about strive for five, this is what we mean. Um, you know, Keeping it very simple, not just for yourself, but any family and friends that you have as well who you see suffering. It's a great framework to just share. It's like, it's a simple question. How many headaches do you have in a month? More than five? Yeah, go see, you can see somebody and they're going to get you better. And it's not going to be a huge investment that you have to put in. You're not going to have to see five different doctors. Now that a place like Mind Plus exists, we can see them the same week, and start to and get them on a treatment plan that's really going to legitimately get them better, really quickly. Um, and even if you've seen a doctor before, talk to patients all the time. Yeah, I last saw a doctor 15 years ago for my condition. I spent years trying to figure it out. I got to as good of a point as I could get. I still have about 20 headaches a month or potentially daily head pain. And this is just my life. It's fine. It's fine. I'm carrying on. Um, you know, Strive for Five is here to say, no, that's not okay. You don't have to do that. You got one life to live. Come on in and let's really get you in a place where you feel really good about how you can manage your condition and how you're able to manage your life. So with that, um, thank you very much for the time today. Very much appreciated. Um, and I'll hand it back over to Tracy.
Thank you, Aaron. That was awesome. So, did anybody have any questions that they wanted to address before we wrap the meeting? It doesn't seem like it. I don't see anybody in the chat but feel free to unmute yourself if you did. Okay. I'm trying to think of any questions I have. I don't know, you were just so thorough. I feel like I've got the gist?
Okay, cool. Well, thanks again. Um, and our information's up there on the screen with any questions or anything that anybody has. And, we look forward to helping folks really achieve this goal. And hopefully, for those of you that have not achieved this and have been really going at this for a while and you want to do better, you can. And and here's how we do it. So thank you.
Awesome. Thank you. Have a good rest of your day, everybody. Thank you for coming.
All right.
Thanks
Bye.
a lot. Bye.
Bye-bye.